Hi, I'm Dr. Chip Lavie. I'm Professor of Medicine in the Department of Cardiology at the John Ochsner Heart and Vascular Institute, Ochsner Clinical School, the University of Queensland School of Medicine in New Orleans, Louisiana, and I'm here today to discuss our paper entitled Body Composition and Coronary Heart Disease Mortality. Is this an obesity or a lean paradox? Which will be published in the September 2011 issue of the Mayo Clinic Proceedings. I'd like to first acknowledge my young colleagues who played a very major part in this study, Dr. Albin DeShooter of the Cleveland Clinic in Florida and Dr. Dorm Patel. And also Dr. Surya Ortham and Dr. Richard Milani were co-authors on this study. Certainly it's well known that overweightness and obesity are increasing in epidemic proportions in the United States and the world. And certainly overweightness and obesity are major factors that contribute to almost all of the coronary heart disease risk factors. They raise triglycerides and lower HDL cholesterol. It increases blood pressure. There's increased glucose abnormalities, metabolic syndrome, and diabetes. And obesity predisposes to further physical inactivity. But in addition to this, obesity is probably an independent risk factor for coronary heart disease. But despite this strong evidence of the role that obesity and overweightness play in the development of coronary heart disease, now numerous studies as well as large meta-analyses clearly show that the overweight and obese with coronary heart disease, who already have coronary heart disease established, they tend to do better from a prognostic standpoint than their leaner counterparts with the same disease, a process that's termed the obesity paradox. Well, one of the limitations of many studies that have assessed this is that they define overweightness and obesity just by body mass index, or BMI. And we know that BMI does not always truly reflect body fatness. So the important part of our study was that we not only measured BMI, but we also assessed body fat. And we defined low BMI as less than 25 kilogram per meter squared, and we defined low body fat as less than or equal to 25% body fat in men and less than or equal to 35% body fat in women. And we studied 581 consecutive patients with coronary heart disease who were followed for 3 years. In this study, we demonstrated that the only patients who had very high mortality were those who had both low BMI and low body fat. In fact, they had an 11% mortality, whereas all of the other patients had less than a 3% mortality. Moreover, in multivariate analysis, we found that low body mass index and low body fat were both independent predictors of increased mortality. In fact, when using BMI and body fat as either a continuous variable or as a categorical variable, they were both independent predictors of mortality. In those patients with low BMI, they had an increased mortality risk of 3.6-fold, and those with low body fat had an increased mortality of 3.5-fold. Now, we believe that these results have significant implications to clinicians and to our patients. Certainly, there are numerous patients who are overweight and obese, greater than 70%, unfortunately, in the adult population. And when these patients develop coronary heart disease, as they frequently do because they're at increased risk, at least we can encourage these patients that it's not doomsday, because they tend to have an overall quite good prognosis, especially if they follow a good preventive regimen, follow the therapeutic lifestyle changes, take their medications, and even more so if they attend cardiac rehabilitation. These patients tend to have a fairly good prognosis. Now, on the other hand, the patients who are the leanest, patients who have both low BMI and low body fat, they probably develop their coronary heart disease for a totally different reason, probably for genetic predisposition, and this makes them more resistant to therapy. So they have a higher risk, a higher mortality risk. So these patients will have to be followed more closely and probably managed more aggressive medically with antihypertensive therapy, lipid therapy, platelet regimens, as well as intense efforts on smoking cessation. And hopefully this will improve their prognosis. Now, certainly it would be important in the obesity paradox, or as we termed it in the title of the paper, the lean paradox, because it's actually the lean patients who are having the worst prognosis. It would be important to determine the mechanism of this phenomenon. Certainly there have been individuals that have suggested that it's due to confounding factors, things like smoking and chronic obstructive pulmonary disease, underlying other chronic diseases. We did not find that this was the case in our study. In fact, only 1% of our patients were current smokers, and we assessed chronic obstructive pulmonary disease, and this did not negate the findings related to the obesity or lean paradox in our study. Other individuals have published data that suggests that fitness affects the obesity paradox. In fact, Dr. Paul McCauley last year in the Mayo Clinic Proceedings published a paper in a large number of veterans that showed that the obese veterans who were unfit, they tended to have a high mortality. And in a recent paper from the Mayo Clinic investigators published this year in the American Heart Journal by Gould, Ray Squires, Randy Thomas, and their colleagues, they assessed fitness by cardiopulmonary stress testing in coronary heart disease patients, and they also showed that the obese who were unfit tended to have a higher mortality. Now, we also did cardiopulmonary stress testing in our patients, and still, even though peak VO2 was an important predictor of mortality, even when peak VO2 was considered, still low body fat and low body mass index were independent predictors of higher mortality. Other investigators, in fact, from the Mayo Clinic, Francisco Lopez Jimenez, as well as the Gould paper, Francisco Lopez Jimenez's paper was in JACC this past year, and I mentioned the Gould paper in the American Heart Journal. Both of these papers showed that central obesity was not protective in obesity. Now, our results in unpublished data do not show the same finding. We did not specifically measure waist circumference in the present study. In conclusion, although we have an obesity epidemic, the data shows that in coronary heart disease patients that the overweight and obese are doing better, and the patients who have the low body mass index and low body fat are having the highest mortality, which could be termed the lean paradox. In fact, both low body fat and low body mass index are independent predictors of higher mortality. Further studies are needed to determine optimal body composition in both the primary and secondary prevention of coronary heart disease.
We hope you benefited from this presentation based on the content of Mayo Clinic Proceedings. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you're interested in more information about Mayo Clinic Proceedings, visit our website at www.mayoclinicproceedings.org. There you will find additional videos on our YouTube channel, and you can follow us on Twitter. For more information on healthcare at Mayo Clinic, please visit www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.